Hi, April here. So I'm back to do a few more exercises with you. We've gone over the pelvic stabilization exercises. Super important to get that pelvis level. So before you do these, you need to do those. And there's another video with those on them, also a reel. So check those out. Those are the sciatic relief exercises with April. That's my .com. That's my website. Those are all four posted there. And these are going to be for gentle stretching, because after you do a little stabilization, it's also really important to have things stretched out, but you want to do them in a comfortable, pain-free way, because anytime you create more pain, you're going to keep that cycle of inflammation going. So, pain-free. And we are not, if you've watched any of my reels, we do not stretch the piriformis. No stretching of the piriformis. We stretch other things around it. So let's get started. So you're gonna need a strap, some kind of strap, a belt, whatever. There's a link on my website to Amazon if you want to buy a strap there. I just use a little cushion here for my head, but you want your neck aligned. Then you're gonna the first thing you're gonna do is stretch out your hamstring. So to do that, you want to put the strap on your foot. You're going to straighten out both legs. Your leg with the strap is going to come straight up until you feel a stretch, but not a pain. No pain, no shooting pain, just a stretch in your hamstring. Now, most people have very limited hamstring, like to probably about here. So if your knee starts to bend, you've overstretched your hamstring. It's on slack now. So you start straight and bring it up till you feel a stretch. Could be here, 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 here. For me, I have really good hamstring flexibility for the most part. So here we are. Then you hold 20 seconds. You just need to do a couple. Then the second one, you want to stretch out the big muscles in your thigh, the front of your thigh. So you're going to scoot over to the edge of your bed or your sofa, whatever you can lay on, and you're going to put your foot down on the side of the bed. And it's just going to hang there. You might already feel a stretch. Now, if you don't feel a stretch, you can bend your knee back a little bit to feel a stretch. So I'm pretty flexible, so I can bend my knee back pretty far. I know it's hard to see here, but basically my knee's bent like this. But most people are only going to be maybe here. So your knee's coming back and you're feeling a nice comfortable stretch here. Now, if you feel that radiating pain going down your leg, stop immediately. I found that usually means somebody has a disc out of place and you don't want to push that onto the nerve and cause radiating pain. So if you feel that kind of pain, you need to stop. You should only feel a stretch. And then you bring your leg up, and then you're going to, depending on how flexible you are, you can take it off the one side and put it on the other side. And then you're gonna bring your leg up, knee straight, till you feel a comfortable stretch. And again, most people will only be about here, perhaps lower, and you don't want any radiating pain, okay? All right, and then you would do the same thing. You would go over to the side, take your pillow with you, and put your leg down and stretch it by bending your knee, okay? So 2 for 20 seconds is plenty, even 1 for 20 seconds daily. You can do them a couple times a day, but you don't need to overstretch. Then the next one you're going to do is stretch your low back. So you're going to put your arms out to your side like this. Your knees are bent, feet together, and you're just going to slowly let your knees drop to one side. Now, I'm pretty flexible and I'm not having any pain right now. I'm not having an exacerbation, so I can stretch pretty much to the limit. If you're having any pain, you only want to stretch in the pain-free range. So even if it's only like here, even if it's only here, okay? So in my case, I can go all the way down, give it a nice stretch, and then come back to the other side and come down and give it a nice stretch. But you need to do it to your tolerance. Stay out of the painful range. So I usually do 5 to 10 of those and hold for a couple seconds. Then to get so that gets a lot of the rotators in your low back. And then to get them further up, you want to turn to your side like this. And again, make sure your head is supported well. If you need another pillow, put another pillow there. You're going to put both hands out. You're going to take your top hand and you're going to rotate it and follow it with your head all the way back for a stretch. And then come back. Now, I'm very flexible, and again, not having pain at the moment, so I'm very flexible. If it starts to hurt anywhere, you can go part of the range. The other thing to keep in mind is that your shoulder can layer there further sometimes. If you have any shoulder problems, don't overstretch your shoulder. You can also, if you had to, I mean, I prefer it like this, but if you had to, if your shoulder were a problem, you can still rotate your back around without actually moving your arm. Okay? Then you would turn to the other side and do it. I also like to do a little bit of a piriformis strengthening exercise, not a stretch. So that, in this case, it's called the clamshell. You may have done it before. You're just bringing your knee up to where it's comfortable and back down. You can also put a band, a TheraBand around your thighs to make it a little more difficult, or you can just start with the weight of your leg. Again, only if it's comfortable. Even if you just have to go to here, that's a good place to start. If that hurts, don't do it. Okay, so you're bringing it up and down. Then you would turn over and do the other side. So from this side, you can see I'm lined up and I'm coming over and following with my hand. Okay? And keep in mind, you only want to go where it's comfortable, so maybe that's here. If you come down, don't let your shoulder fall all the way down. That puts a little stress on your shoulder, not really stretching anymore. You end here parallel to the ground. And then, of course, you can do the clamshell on this side also. So those exercises are really important to do to keep your low back flexible, and also to keep those muscles, those big muscles in the front and the back of your leg. If they're tight, they pull on your pelvis. So I think I showed you this before. Those big muscles in your thighs, they attach to your pelvis. And if they're tight, they're going to pull on that pelvis, going to tilt it one way or the other. That's going to torque your tailbone, which is sitting here. And then on top of your tailbone, you see that L5 vertebrae, that lumbar vertebrae. If your tail is torqued, your spine is torqued, and everything's unhappy. And not to mention that the sciatic nerve, which comes out of your low back and your tailbone, is going to be put on a stretch and could cause pain to radiate all the way down your leg to different parts of your leg or butt, groin, wherever. So very important to stretch out those muscles. Make sure you do it in a pain-free range. You do it regularly and that'll get larger and larger and larger. So that's step 2 in the progression to living pain-free. And a high quality active lifestyle without lingering ongoing sciatic pain, and also cuts down on any exacerbations you might get. So we're going to do another progression of the exercises in the next video. So you can also go to my website, sciaticreliefwithapril.com, and to see the 4 very, very important exercises to start with and to continue and to do before these that will stabilize your pelvis, get it back in the right place. There's also a place for private coaching for pain. If that's something that interests you, you can sign up for it there. So anyway, get to it.